The Adulting with ADHD podcast is not a substitute for medical advice. Please see a medical professional if you think you have ADHD or if you have questions about your current treatment. To support this podcast or to access the podcast archives, visit patreon.com/adultingwithadhd. This is the Adulting with ADHD podcast, self-empowerment for people with ADHD. Today, I'm happy to have with me Tamara Hiller. She is a midwife based in Portugal. How's it going, Tamara?
Hello, thanks for inviting me. Thank you.
Thank you so much for being here. Let me set up this interview a little bit. A few weeks ago, I say a few weeks ago, it was a long time ago, but a couple of episodes ago, I interviewed an ADHD coach, and she was talking about pregnancy and ADHD, and she mentioned that midwives may be a good option for ADHDers. It may be something they hadn't thought of before, but that there's a lot of things midwives do that can actually possibly benefit them. So I was going to ask you some questions about that, since you are a midwife with a specialty in, would you say, natural medicine? Is that accurate?
Yeah, I'm also a professional herbalist. Now, at the moment, I work more in natural health, as not only in birth, but yeah, I'm both.
Welcome to the show. I'm so happy to have you. So do you want to tell us a little bit about what a midwife does?
Yeah, a midwife, practically, she is a primary caregiver. She's a medical professional for the whole period of pregnancy, during birth, and also after birth. I mean, she can help a woman basically through the whole breastfeeding period, even if the baby is already older. And she can also be, the first one to confirm your pregnancy, to do blood tests and get the results, do vaginal exams, measure your blood pressure. She can do most of the whole prenatal checkups. In some countries, midwives are even doing the ultrasound, or this depends on the country. In most countries, they probably work together with a doctor. But in Germany, where I'm trained and I practice as a midwife, we often did in a healthy normal pregnancy. The midwife is also authorized to do the whole prenatal checkups and oversee the whole pregnancy. And actually, we even have a law in Germany that a doctor is not allowed to do a birth without a midwife. So he needs to have midwife present. Yeah, because a birth is never only a medical procedure. We want to work a lot on the side of prevention and actually prevent things from going bad, so that we don't need the heavy medical interventions. So the midwife is always there to look after also to the emotional side, practical side of things, to prepare the woman. Women have a tendency to focus only on the birth. This is like the big event. And of course, the outcome is often kind of unclear in how it will go. And there's a lot of fear around that. But the whole journey starts after birth. When you're at home with the baby, you need support with breastfeeding and the whole lactation period. So we also have a strong focus in our work to prepare the women for this. I worked like in a little practice with other midwives. So we had a whole, where we offered courses, everything from birth preparation courses, and after the birth, like pelvic floor exercises or baby massage for the babies later, acupuncture, like natural healing methods, of course, as much as possible, because you do not want, you want the least pharmaceuticals normally during pregnancy. So many women look for alternatives, and there are many alternatives. So she can basically work in hospital during birth. And most of the time in hospital, of course, it's also in cooperation with the doctor, or especially if things are a bit more challenging or there are difficulties. A normal birth she can do alone in different settings. We also have smaller birthing houses that are completely led by midwives and midwifery teams that have a doctor on call. But usually, if everything's fine, this will be two midwives together who oversee the birth in one of those kind of natural birth houses, let's say. So it depends on the country where you're in. But those are just the wide range of work that midwives do.
That's super interesting that a midwife is required at the birth in Germany, because here in the United States, I think people are so warming up to this idea of midwifery, even though it's been around for a very long time. And I think probably my grandma and grandma's mom, I'm sure they had midwives in their generation.
Yeah.
So let me ask you, it sounds like there's so much they could do for you. What do midwives, what don't they do?
Yeah, a midwife, she does not do a cesarean alone, for example. In certain risk situations, of course, you need the doctor, or they would cooperate and work together. But also, even at a cesarean is also a birth. So in Germany, it's also required there is a midwife during the cesarean and right after the cesarean, receiving the baby, establishing the first contact, helping with the first breastfeeding. Also it is important. It is a bit more difficult, challenging situation for the bonding, for the breastfeeding and all that. You need this expert by your side to see, is the baby drinking? Is he showing the reflexes and everything? Washing the baby or measuring and all those. This is normally what a midwife does. Yeah, she works in some situations, of course, in cooperation with the doctor, not alone.
Yeah. That's super interesting because I've been thinking a lot lately about how having a midwife could have changed my ADHD pregnancy. And it seems like a midwife could help any pregnant person, but it seems like it would be a lot better with a midwife because then you have this kind of accountability system where there's this one person whose only job is to look out for your well-being, and that's huge. And a lot of us easily forget that part of just well-being in general, not even while pregnant. That's really interesting. And I have here in the questions I sent you we prepared ahead of time, I said there's 3 common challenges I kind of wanted to bring up, and we could talk through each one quickly about how you can address those naturally during pregnancy, because you're also a specialist in natural medicine. Is that right? So when we talk about focus as the first one, let's say you have a client and she's got ADHD and she's having problems with focus. To me, that seems like that could really cause a lot of anxiety. But what kind of things help expectant mothers?
Yeah, with focus, I think it's important you take your regular supplements, but not only your kind of multivitamin prenatal, but also a good omega-3 supplement, which is very important for the brain. You're doing something good for the baby's brain and at the same time for your own brain. Of course, this is not something you take and you feel the effect an hour later. This is ideally you start having this as a routine practice every day for a long time, but it's still not too late. You can start this in pregnancy anytime, and it will be highly beneficial. I mean, people with ADHD, probably they know how they react to stimulants. No? So some cannot have any coffee, or some get maybe even something out of it. I recommend also green tea because it is a bit softer than coffee. You usually don't get the jitteriness, but you have at the same time actually a calming, grounding effect. This is also, we have one acid that is also available in supplement form. It's the L-theanine. And L-theanine, it can be taken actually to increase focus. It can also be taken for sleep because it just has this effect on the brain, that it gives you this calm alertness. So I recommend things, that support this natural calm alertness and not, stimulants or also herbs that could be too stimulating, like coffee, but maybe the green tea, the omega-3, a good B complex, a complex of B vitamins, very beneficial to the brain. Magnesium, it's just for everything. You can take it before bedtime. I like to push it a bit with the magnesium. I usually recommend, go up by a capsule every day and just see what happens. It does cause loose bowels. This is just a characteristic of magnesium. You can take a form that does not cause that much loose bowels, like magnesium glycinate, and you can really push the dose a little bit, just that you feel comfortable and not having too much or loose stools. But also constipation is an issue in pregnancy. So have 2 for 1, I recommend this for sleep, for concentration, it's good for the hormones, for everything. It's, there's so many enzymatic processes in the body that need magnesium, and all modern people are deficient in it. Same for vitamin D. Vitamin D has also very important brain function. You can try some teas. Some people actually, it increases their focus if they calm down a bit. If they drink a chamomile tea or even valerian or lemon balm. We have lots of herbs that are totally safe in pregnancy. You could make your pregnancy mix, put some red raspberry leaf in it, which gives you minerals. It's also very tonifying for the uterus. It makes contractions during birth more effective. It can prevent bleeding. This is all from scientific studies, but this herb is around hundreds of years. It has been given to women. Now we have the studies confirming that. Now we have a study that confirms eating simple dates, those big, eating 6 of those a day in pregnancy gives you better birth outcomes. It makes labor easier and shorter. You don't go over term. And it's just this extra bit of nutrition, anything that you can do that gives you this extra bit of minerals, like drinking some herbal teas. And I recommend, really learn this technique, instead of buying a tea bag with like 20 tea bags and they all have 2 grams of herb in it, go and buy half a pound of chamomile flowers or something and use 1 or 2 tablespoons per cup. Those are totally safe herbs, very mild. Start with a bit less and then increase it until you really get the effect. Even something like chamomile tea, it can increase your focus. It can help you sleep because it just brings you into this calm zone. It helps you, stay calm and focused.
Yeah. These days, I've found myself needing quicker access to therapy from the safety and comfort of my home. This is why I started using BetterHelp for my immediate therapy needs. They will assess your situation and match you up with a licensed professional therapist, one who you'll likely start communicating with in 24 hours or less. It's more affordable than traditional therapy, and financial aid is available. You can do it through text or chat if you don't like phone calls or video appointments. To get started and to save 10%, go to BetterHelp, HELP.com/ADHD adulting.
I never put this together until now, but I did drink a lot of chamomile tea. And it makes sense now. I always knew it was good for sleep, but it makes sense that it would calm you down too. I've been recently learning a lot about how focus and anxiety are connected. And it's crazy how everything's so just interconnected.
Absolutely.
So it sounds like, did we cover stress and sleep while we were talking earlier? So that's really everything. And I love the idea of getting these fresh chamomile flowers. Like, it never occurred to me. That's something I'm going to try and I'm not even expecting. That's fascinating.
Yeah, for sleep, you can, for example, valerian is really more like calming and for sleep and for stress. You could take it during the day if you manage stress or anxiety with it, but it's not going to increase your focus. So some herbs are more on the sedating side. Chamomile is a bit in between, really. It depends. You have to really see what it is for you. If you are good with it during the day or if it's more for sleep. But some herbs are more on the sedating side, like valerian, or hops or wild lettuce. You can take those as a tincture. Maybe you don't want to get up at night, you can't fall asleep again, you don't want to brew a tea, but you can have those in a alcohol-free tincture form or as tablets or something. So you find something like that in the health stores. And even some simple breathing exercises. So I have very easy breathing exercise. It's called alternate nostril breathing. Now you breathe in through one nostril, then out with the other. Into this again, out with the other. You do this like 10 times, your vagus nerve gets this reaction, you just calm down and you're more in this rest and digest mode. It works. It's really effective. Even a simple breathing exercise like this during the day when you feel, just out of balance and you want to go back to feeling calm and focused.
Yeah, awesome. Back to midwives, I did have a question. I don't know. I think it might be different in different parts of the world, but in the United States, I think midwives might be considered a service or a resource that maybe we can't all afford. But it sounds to me, after talking to our previous guest, that there's lots of different kinds who charge in lots of different ways. And it seems like no matter your lifestyle, is it true, you can probably find somebody to help work with you think?
In Europe, it's differently organized. We have this all paid by the national health care system. I also want to mention, if it's the midwife is also the medical professional at the same time. There's another profession within this whole spectrum of birth helpers, which is the doula. So people can find a doula. She is not taking care of your blood pressure or of the heartbeat of the baby or something. She is more maybe giving you massages, making you comfortable during birth, also talking to your doctor during birth, making sure maybe your wishes get respected. Can be very helpful to write a birth. Just write it out. What is your ideal birth? Which medical interventions you do not agree to unless they are strictly necessary. We know today, most cesareans are not strictly necessary in a medical sense. They are taken out of extreme precaution or sometimes even just to avoid liability issues. This is a simple fact. And I encourage women to be as self-empowered as possible and to not just hand over everything to the hospital and to the doctors, but to set their limits and to know before what is likely to happen, because every intervention causes another intervention or causes certain side effects or problems down the road. So a doula can also be the person, you take alongside a family member, your husband or whoever, to the hospital, and she's at your side and she knows, how to get you back to the breathing exercises you learned, because you will forget all that, if you don't have somebody there. If you don't have somebody there breathing with you or going through the steps in your head and calming down and feeling comfortable, yeah, it's good to have this person. And I mean, the doula, she will stay cool, she's a person, maybe, your husband, not so much in this situation. He will also be nervous. He is also not in his environment. I think husbands are often of great help in a home birth setting. We need them. They have many practical things to do in hospital. They often don't know what to do, and they're more on the side. So the doula can intermediate and help make the woman feel more comfortable, feel more at home, and having a person she trusts and who knows about the medical possible interventions that might come up and how to deal with them. Because you always have a choice. You have the autonomy over your body. And I think women should be more aware of that they don't just accept what's offered to them.
That's so true. And that is no more obvious than in the mental health field. I know in the ADHD community, we talk about it a lot, about how you're really the best expert of your own mind and body. No one's going to know more than you. So that I'm glad you drove that point home. So do you have a YouTube channel? I feel like I've watched some YouTube channels, and you want to tell the listeners about your YouTube channel?
Yeah, I have a YouTube channel and also a podcast, actually. At the moment, I'm even excited about my podcast because I can talk for longer.
Yes.
So the YouTube channel is called Herbal Help by Tamara. The podcast is called Down to Earth Herbalism with Tamara. And I have already 3 episodes also about which herbs can you take in pregnancy and which not, which are beneficial, how to prepare the teas. And I even have an episode about some brain herbs that are also would be beneficial for somebody with anxiety or ADHD. And I talk about herbs and herbalism and health. And
Wonderful. Anything else you want to update us with, what you're up to or where we can find you online? It sounds like.
I also have a website there you can find the links to the podcast and to the YouTube channel. It's called herbalhelp.net. So it's herbal help, like HELP, not health, herbalhelp.net. And you'll find my offers. Also, I offer health consultations. And if people want to bring their health back with natural medicines, offer those consultations.
Awesome, Tamara. Well, thank you so much for being here. And I can't wait to get this information out to our listeners. Really appreciate it. And I will be following up with you soon.
Thank you so much, Sarah.
Hey guys, I'm here to ask a little favor. So, in order to grow the podcast even more, it's come to my attention that I should probably survey you guys to get a better idea of who's actually listening and what you guys want and what you don't want. If you could, pretty please, go to adultingwithadhd.com/survey. It would help me immensely to have this information, not just for myself as I'm creating content, but for any potential partners who may want to help grow the show. I would like to find people who are exactly right for you guys. Thank you very much, and until next time, happy adulting.